If you ever had dental work done, crown, fillings, implants, and it's failed, and it was done again and it's failed again, that's not just bad luck. There may be something else going on, and we really need to dive into that to figure out what's causing that to fail. Let's talk about reasons for why that might be. Let's start with the thing that most patients have never really either thought about or had explained properly to them: your bite. So when you bite down vertically, you're creating a lot of force and pressure. Your jaw muscles are actually capable of creating almost 150 to 200 pounds per square inch of force on your teeth. So let that sit for a second. If you look at the math, that's thousands of pounds of pressure being applied to your teeth multiple times a day for decades and decades. That's a lot of force. So when your bite is ideally balanced, the force is distributed equally across the teeth, and that's the way the body is made. Ideally, every single tooth is absorbing the load, especially the back teeth when you're biting up and down, and every tooth is designed to share that load. There's not a single tooth that sticks out more and can handle more force and duress. They all want to equally distribute that force. But if your bite is off even a little bit, we're talking microns, it can make a huge difference. Some of those teeth may be taking hits and forces they weren't designed to handle. So every single time you bite together and close your mouth, for days, for months, for years, it is pounding on those teeth in an unnatural way. So if you've got a crown that's only a tiny bit, microns, very, very little bit high or out of occlusion, and it's taking that force multiple times, eventually over time, it's gonna cause damage to that tooth, whether it's the porcelain breaking on the crown, the cement layer breaking down, the roots getting damaged, causing bone loss. There are lots of things that can happen if a tooth isn't in harmony. And if you don't adjust the bite and get it balanced before you just make a new crown, you're probably just gonna recreate that same harmful solution. It's not necessarily the crown itself is wrong, it's just not fitting harmoniously into the bite. The bite needs to be made sure that it's perfect. Next, let's talk about hygiene, but not necessarily in the way you've heard me talk about it before. Most people think hygiene is a pass-fail. Do you brush your teeth twice a day? Do you floss your teeth? Yes or no? It's a lot more specific than that. And here's actually what really matters more than that when cleaning around dental restorations. It's all about how you take care of the margins, which is basically the edge of where that crown meets the tooth structure. The margin is by far the most vulnerable spot in any restoration. If plaque builds up there and you don't clear it off every time you brush and clean, and you don't specifically remove that from the margin, the bacteria will microscopically start to get underneath that junction between the restoration and the tooth. And when that decay forms at the margin, the restoration has failed. Sometimes we can go in there and clean it up and put a patch filling in there, but that really just buys us a little bit of time before the crown's got to be redone. So different restorations actually have different hygiene habits. So for example, if you have a bridge, you have to clean underneath the fake tooth, and regular floss isn't going to cut it. Implants, for example, need even more attention at the gum line. And a removable appliance has even more specific protocols for taking care of it. So if no one showed you specifically how to clean around your actual dental restorations, that's some information that you need to have. Just saying brush and floss is not enough. Your diligence and your habits are not going to make that big a difference if you're not cleaning in the right area and doing it correctly. I encourage you to ask your hygienist at your next cleaning to specifically show you how to clean and what clean looks like for your individual restorations. That one conversation could change the entire lifespan of all your dental work. In dentistry, the materials we choose and the design of how we use those materials are two separate things, but they are related, and both of them matter equally. So most dentists and patients focus on the materials: porcelain, zirconia, gold, composite. And while those are very important, you also have to look at the design, because even the best material will fail if it's not used correctly. Here's what I mean by design. How thick is the material at the most critical juncture of the stress that goes on it? Is there enough tooth structure underneath to maintain and hold on to that restoration? How is the crown attached to the tooth? Is the shape of the crown designed in a way that those forces are distributed naturally and ideally? A crown that appears fine on an x-ray can still be failing and faulty because it's not designed correctly. You have to look at the contours, the contacts with the adjacent teeth, and the overall shape and size of the tooth to make sure it's designed correctly. And this is part of the reason why the same procedure done by two different clinicians can have very different longevity and outcome. So it's not just about the skill of the clinician, it's also about the philosophy of the design that you built to function in the mouth. So if you're dealing with something that's failed 2 or 3 times, it's probably time to pause and ask, is this a material problem or is it a design problem? This next part is for my grinders and teeth clenchers out there. Roughly 1 in 3 people clench or grind their teeth, and the majority of them have no idea they do it. And here's why. The majority of your teeth grinding happens at night while you're asleep and you have no idea. So when you wake up, you might have some soreness or some tenderness, but you go about your day not really thinking much about it. You just attribute it to daily stress or clenching throughout the day. What's actually going on is your teeth are being subjected to forces almost 3 to 5 times higher than they are during the day, and that's been sustained for multiple hours through the night. During this time, crowns can crack, fillings can fracture, natural teeth can break down. You can also knock veneers off. You can also cause implant crowns to start to fail. And oftentimes patients will come back in confused because they're doing all the right things and yet they're having failing restorations. So if you're doing everything right during the day, but then things are failing, most likely it's because it's happening while you're sleeping. A well-made night guard is one of the least expensive, most protective things you can do. It's not going to stop damage that's already been done, but it's definitely going to play a role in preventing future damage, especially at night when you're not aware of the damage you're doing. So let's bring this all together, because the whole point of this video is to not make you anxious about your dental work failing over the lifetime. The whole point of this video was to help you see your mouth as a whole system, not just individual teeth, but how everything kind of works together as one whole group. So if you're having failures with cracking and breaking teeth and porcelain off of crowns, I want you to think about something going on with the bite, the grinding, forces are being created that is overwhelming the teeth. If your failures are more focused on decay recurring at the edges of the crowns or the margins breaking down, you might want to focus a little bit more on home care and hygiene and keeping those areas clean. If the failures keep happening in the same areas over and over again, maybe something else that needs to be addressed. And if they're happening everywhere across multiple teeth, top and bottom, back and front, that might be something systemic in nature. None of these things are your fault, and they're almost all manageable. You just need to be diagnosed and come up with a treatment plan to handle them. Here's the thing I'm asking of you. If things have failed more than 1 or 2 times, don't just ask how to fix it. You might want to ask why they keep failing. That question of why it's happening is going to be the thing that changes everything. And once you understand the environment and what's going on in your mouth, you'll stop being a passive participant in this damage and be proactive in fixing it. And that's really what this channel is about. So subscribe if you're finding this information useful. And drop us a question below in the comments, especially if you've had work fail in the past. I'll see you in the next video. I'm Dr. Brett Langston, here to help you watch your mouth.
Down in Brookhaven with a smile shining bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on pots, the dumbest you've ever seen.